Hello, everyone. Again, my name is Samantha, and my project has to do with healthcare and housing. This summer, I really learned so much, and I'm really excited to be sharing what I learned with you all. So, just to go over a quick agenda, gonna share a quick introduction, a purpose, my findings, some key takeaways, and some proposed solutions. So I chose this project because I've always grown up passionate about healthcare and improving healthcare access. I was probably influenced by my mom, who's with us today, who is a nurse practitioner. And so I wanted to find a way to improve healthcare access on Cape Cod. And it was clear that housing is one of the biggest barriers to care on Cape Cod. And so I really just wanted to understand more how housing is really affecting the healthcare workers. So, the Cape's aging population is driving up the healthcare demand. By 2030, it is predicted that in Brewster, the population that is 65 years and older is going to be approximately 60%. And so, with that, there's definitely a greater healthcare demand. And while this demand is increasing, the staff shortages are growing. And there's also a lack of year-round housing, which makes it harder to recruit and retain staff. Not to mention the financial burden. So because many staff cannot live here, um, the we rely a lot on traveling nurses. And so traveling nurses cost approximately 25% more than permanent staff. Also, one primary care physician on Cape Cod, specifically for Outer Cape Health, is now serving 1,400 patients or more. And that is just not sustainable at all. So I decided to develop a survey, which was completely anonymous. And the design was meant to be scalable, and this can really be replicated for other industries or other health centers, the more hospitals on the Cape or other regions facing similar challenges. And I wanted to do this to better understand the housing impacts and specifically hear from workers themselves. And so I collected feedback from approximately 40 staff at the Duffy Health Center to assess the housing stress, and the hope is that the results will inform real policy. So I heard most of the staff that I heard from, around 90% were full-time staff at the health center. And I heard from a broad range of roles, including administration, registered nurses, medical assistants, clinicians, even an intern. And over 51% have worked in Cape Healthcare for over 10 years. So only 38% report that their housing is both stable and affordable. And so that means that 60% are not. And 1 in 3 are housing insecure. Over half spend 30% or more of their income on housing. And with the rising costs of the cost of living today, that also is not sustainable for the workers here. So housing stability is a real issue. 35% say that they were likely to leave their job in the next 2 years due to housing. So for the Duffy Health Center that only has about 100 staff, this could really be detrimental to not only the staff itself, but also the patients. And 78% have considered leaving Cape Cod or turning down a job because of housing. That is an incredible percentage. Also, over half said that they would move closer if more affordable housing was available. So over 90% of the respondents stated that homes are just too expensive, and that is their primary obstacle, half of which mentioned issues like credit, debt, or mortgage qualifications. Over a third said they struggle with uncertain employment or earnings, while 27% said they cannot find year-round rental housing on Cape Cod. So I also thought that it was very important to really hear from the workers themselves about what they say they would need. And so the top two choices were that people said they would like more affordable rentals and starter homes. Many people also said that they would like help becoming first-time homeowners, as well as employer-supported housing. And other options included townhomes and seasonal housing as well. So the key takeaways from this survey was that housing costs are clearly impacting workforce retention. Many workers cannot afford to live near where they work, and so clearly there's demand for housing, for realistic housing solutions for healthcare staff on the Cape. And so I thought that it would be very important to generate a few ideas about potential solutions based on these issues. And so all of these solutions listed here are current programs that are on the Cape. And so my solutions have to do with expanding these and altering them a little bit specifically or tailoring them specifically for the healthcare staff. So the first program that I think could be expanded is the Host Homes program. So this is a current program that is run by the Homeless Prevention Council. And so this program matches youth ages 18 to 24 with local hosts, where they stay with them for up to 4 to 12 months. The hosts receive an $1,000 monthly stipend, and the guests also receive case management and life skills. And so I think that there is great opportunity to expand this specifically for healthcare staff, specifically for certified nursing aides, recent graduates, new nurses. And this can really help entry-level workers live and work locally and find a way to come to the Cape. And so I think it can also ease transition post-graduation. Not to mention, there are incredible benefits for the host and the guest. For example, there was a study conducted in the UK in 2022 where 96% of older participants reported feeling less lonely. 86% said they felt happier after matching with the home sharer. Also, 61.5% of younger home sharers reported greater financial security, and 55% said they experienced reduced loneliness and built friendships. So really, this is a win-win solution for both parties. And so I think that this can be expanded and supported specifically by the health centers or hospitals or other centers here on the Cape. And I also think that it would be of benefit to extend um, the stays for up to 2 years, whether that means going from host to host or staying with the same host for those 2 years. And I also think that it would be a benefit to expand the age from maybe to go from maybe 18 to 28 years old or 30 years old for the new recent grads or new nurses. And I also think we could add mentorship and career pathways to allow the certified nursing aides to become LPNs or registered nurses. So again, this is a program that currently exists, but I think it has real potential to be expanded specifically for healthcare staff. So the second solution I propose has to do with the Thrive program that is currently that was launched in 2021 by the Housing Assistance Corporation. And so this program is a $450 monthly rental subsidy. And you are eligible if you are an essential worker. But the essential workers that are listed under this are people who work in childcare, disability services, education, people who work in nonprofits. But healthcare workers are not listed as essential workers here. And so I think that there is definitely opportunity to include healthcare workers on this eligibility list for those who have 100% AMI or below. And I also think to match the rental costs, we could raise the subsidy, which could be supported by Cape Cod Healthcare and local health centers. So again, Thrive already exists, but there is definite opportunity to expand this program specifically for healthcare staff. So expanding Thrive definitely supports workforce stability. So the third solution that I think could be a great solution here, again, has to do with Housing Assistance Corporation. So if you go on their website right now, there is a section that you can find basic year-round rental listings. It's very accessible. It's very clear about what affordable units are available. Um, but I think that we could make this specifically tailored for healthcare staff by making listings searchable with filters like rent location or type. So let's say I work at Duffy Health Center. You could type in where you work. You could type in what you were able to pay for rent or how much you make, and then it could type in exactly or your best match based on your searchings. And so again, we could add a dedicated section for healthcare workers, or even this could be expanded for people who work in childcare. Again, this could be used for other industries besides healthcare staff. But again, I think this could be supported and could be implemented with collaboration with healthcare providers to promote listings and even including local guides for new workers. So again, we don't really need to reinvent the wheel. There are definitely options and opportunities out there that just need improvements and expansion. So it is clear that housing is healthcare. Stable and affordable housing is essential for retaining Cape Cod's healthcare workforce. The survey results speak clearly, and solutions exist. Again, we do not need to reinvent the wheel. We just need to adapt current programs, expand eligibility, and build targeted housing solutions. And so there is a good path forward if we have more collaboration between housing agencies, healthcare providers, and local governments. So with this, we can definitely turn ideas into action. So thank you for listening.
All right, you left them speechless. No.
I just have a comment. You did wonderful. That's just impressive. Thank you, Sam.
Thank you. Thank you so much.
I echo that. This was fantastic. And I think one of the best things you did with your suggestions was to, you kept repeating, we don't need to reinvent the wheel, just make it better. And, I think every day I look at houses that I drive by that are only used, a month or two maybe. And we can be a lot more creative about how we incentivize and how we use the existing buildings on the Cape. So thank you for pointing that out.
Great. Did you find in your explorations that there was like a difference in awareness between, say, ground level workers in the healthcare system versus their bosses and the higher ups?
I mean, I think for the ground level workers, it's definitely harder to recruit these workers. New people are not really being able to come on the Cape. And so it's definitely harder to recruit and retain this staff specifically. They can't really afford to be here. So I think I spoke to a bunch of people who work in healthcare, and it was clear that basically like the doctors that we see at these healthcare, they've been here for many a year, and also yeah, they just kind of keep recycling through the same amount of doctors here. So yeah.
Just one follow up. Did any of them speak of like an inflection point, like a time when this problem seemed to like reach a noticeable level in their careers, like here on the Cape? Like,
not necessarily. But I spoke with the CEO of Outer Cape Health, and he was basically saying that, every day their job is to just try to do what they can with what they have. And there are many staff shortages, and there's not much that is really being done about it, but all you can do is keep working. So